Do you have appendicitis? Hi, it's Dr. Fan here. Let's talk about the top 5 signs that you may have appendicitis. Number 5. Anorexia. You have lost your appetite. You cannot even eat your favorite foods. Number 4. Nausea and vomiting. You feel absolutely horrible and can't stop vomiting. It feels like you have some gastro bug, but you just don't have any diarrhea. Number 3. Fever. You have the shakes and feel really cold, even though you're burning up inside and have a high fever. Number 2. Migratory abdominal pain. You have the pain that started somewhere near your belly button, or maybe somewhere else. You're not quite sure because it's very vague. But now it's moved down to the right lower part of your belly, and it's definitely stayed there. And the number 1 sign that you may have appendicitis: severe lower right abdominal pain. It is the absolute worst pain that you've ever felt. You cannot move, you don't want to touch it, and you definitely don't want anyone else to touch it. Doctors call it peritonism, but you just call it the worst pain ever. So, what is the appendix anyway? The appendix is a little appendage attached to the beginning of your large intestines. It does not have any function, so you won't miss it when it's gone. So what should you do if you think you have appendicitis? Well, you should go to the hospital immediately. You need an operation, and that is only offered in the hospital. At the hospital, you will get a doctor's assessment, blood tests, and depending on the assessment, you may even get an ultrasound or a CT scan. It is important to seek professional advice early because your appendix may burst if untreated. If your appendix bursts, you will be very sick and may need a much bigger operation than if you went in earlier. So, what is the best treatment for appendicitis? The best treatment is a keyhole operation to remove your appendix. This is also known as laparoscopic appendicectomy. This is one of the most common operations in the world. It is safe and will cure you from having appendicitis ever again. The scarring will be minimal, with only 3 scars, about 5 millimeters each. You will have a scar near your belly button and 2 further down. I generally make these incisions quite low so that you can cover it with your underwear to reduce their visibility. Are there any risks to surgery? Well, yes. With any surgery, there are risks. However, these are all uncommon. You will be given a general anesthetic, and in rare circumstances, you may have a bad reaction to that anesthetic. With any keyhole surgery, there are risks of bleeding, infection, and injury to any organs inside your belly. These again are all rare. Occasionally, the infection is so bad that we may need to make a bigger incision to clear out the infection properly. We may even need to remove a bit of your large intestines, to which the appendix is attached, if the infection involves the large intestines. But don't be too worried. If you present early and we get the appendicitis operation done early, this is usually very straightforward and very low risk. What can you expect after the surgery? Well, it depends on how bad your appendicitis was. If we got the appendicitis early and the operation was straightforward, then most people will go home the next day. If your appendix burst, you may have to stay in hospital for a few days to get intravenous antibiotics. It will take you a few days before you feel normal again. We will ask you not to strain yourself too hard or work too hard in the following few weeks. This is to reduce any risks of getting a hernia through any of the incisions that we made during your operation. So, do you absolutely need surgery? Well, not necessarily. There is increasing evidence that appendicitis can be managed with antibiotics alone. However, this type of management is for a select population, and you need to be aware of the risks that you may have appendicitis again later on. We only offer this to people who do not have complications of appendicitis, such as a burst appendix or an appendiceal abscess. It is also important that you do not have anything blocking your appendix, such as a bit of poo, which we call an appendicolith. And there you have it, the top 5 signs that you may have appendicitis and what to do about it. Well, I hope that you've learned something new. If you like this video, please like, subscribe, share, and comment for more videos. Please note that the advice provided here is general in nature and that you must discuss your personalized management plan with your treating surgeon. Everyone is different and only your treating surgeon will know the best management plan for you.